The floating kidneys. A floating kidney is a condition where a kidney drops down into the pelvis by more than 5 centimeters, or more than 2 vertebral bodies, when a person shifts from a lying down, supine, position, to an upright position. It is medically known as nephroptosis. It is a medical term derived entirely from 2 ancient Greek words. Nephros, meaning kidney, and ptosis, meaning falling, drooping, or sagging. It is also referred to as a wandering kidney, or a dropped kidney, or simply renal ptosis. Why does it happen? The kidneys are typically held firmly against the back wall of the abdomen by a supportive layer of tissue called renal fascia and a protective cushion of perirenal fat. A floating kidney occurs when these supporting structures are weak, damaged, or insufficient, as discussed in next examples. Demographics. It is significantly more common in women than men, affecting up to 20% of women, particularly young, slender individuals. Lack of fat. A lack of supporting perirenal fat is a primary cause of nephroptosis. Rapid weight loss. Losing a large amount of weight quickly can deplete the fatty cushion supporting the organ, eventually leading to nephroptosis. Physical trauma. A sudden blow to the abdomen or lower back can loosen the kidney's connections. Now let's discuss its common symptoms. The vast majority of people with a floating kidney experience no symptoms at all and never require treatment. However, when the kidney drops, it can either stretch the blood vessels or kink the ureter, the tube draining urine to the bladder. If symptoms do occur, they usually include flank or abdominal pain. It is a dragging ache or sharp pain in the side or lower belly. Positional relief. It is pain that worsens when standing up, but feels significantly better when lying flat. Nausea and vomiting. Gastrointestinal distress that often spikes alongside severe episodes of pain. Blood in the urine. It is microscopic or visible blood, hematuria, caused by temporary blockages or pressure changes. This condition also has a special Dietl's crisis, which is a rare, intense bouts of sudden flank pain, chills, and nausea, caused by an acute blockage of urine flow or blood supply. How will we diagnose this condition? Standard static imaging like a routine CT scan or ultrasound can miss a floating kidney, because patients usually undergo these scans while lying down. To diagnose the condition, doctors must utilize dynamic imaging. Upright and supine X-rays. It involves an intravenous pyelogram or urogram, where contrast dye tracking is filmed, while the patient is both lying flat and standing upright. Positional ultrasound. A Doppler ultrasound performed in both positions, to view changes in kidney placement and blood flow. Nuclear scans. It is a dynamic renal scan, to monitor how gravity impacts split kidney function. When we talk about this, we remember the classic House M.D. episode titled, Don't Ever Change, in Season 4, Episode 12. In that episode, the patient is a woman who collapses at her wedding. She experiences intense, seemingly unconnected symptoms, including fainting, a plummeting heart rate, and internal bleeding. But only when she stands up. The show used this case to perfectly illustrate why a floating kidney, nephroptosis, is so famously difficult to diagnose in traditional medical settings. The chandelier's metaphor. Dr. House memorably explains the condition by comparing the kidney to a chandelier hung by a cheap chain. He tells the patient it had been hanging sloppy for years, until a recent trauma shook it completely loose. Why did routine scans miss it? The diagnostic team ran multiple standard scans, like CT and MRI, but they all came back normal. House realizes the flaw that medical scans are performed while the patient is lying down. When lying flat, the kidney naturally slid back into its correct position, hiding the defect. The aha moment. House catches the diagnosis by manually palpating her abdomen while she is upright, feeling the misplaced organ. He then orders an upright ultrasound to confirm it, and tells Chase to put the kidney back on the shelf via surgical nephropexy. While House M.D. dramatized the extreme cardiovascular symptoms, like the dramatic heart rate drops, the fundamental medical mystery they highlighted is completely real. In actual medicine, a severe, symptomatic floating kidney can cause sudden, agonizing pain known as a Dietl's crisis, which is entirely dictated by whether the patient is standing or lying down.